Hello, I'm County Commission Chair Susan Adams. We've had a lot of questions over the past few days about the federal government's plan to reopen the economy and how that might look locally. So I wanted to take the opportunity today to provide a bit more information regarding this process. As always, COVID-19 information is available on our website at ircgov.com or by calling the Emergency Information Center at 772-226-4000. On April 16th, the federal government released guidelines for opening America up again, providing a plan for rolling back social distancing measures and reopening the country's economy in several phases, depending on your location. Under the guidelines, states will need to meet certain criteria that include demonstrating a downward trajectory of COVID-19 cases over a 14-day period, and a system for testing healthcare workers before they can proceed to a phased community approach. The guidelines also outline state responsibilities to have in place before moving into a reopening plan. These guidelines include protecting workers in critical industry, particularly the most vulnerable and those who live and work in senior care facilities, and having a plan for testing individuals with a focus on vulnerable populations. Once these criteria have been met, the state may move into a phased approach to reopening facilities. Under this three-phased approach, facilities and businesses may be opened back up in a manner that is based on up-to-date data and readiness. It mitigates the risk of resurgence, and it protects the most vulnerable in our communities. Governor DeSantis has created a task force for the state of Florida to map out and issue guidance on what this phased approach will look like, and additional information and direction is expected later this week. As we work through this process and coordinate plans and efforts, Indian River County will continue to work with our regional, state, and federal leaders to ensure that our plans locally follow guidance issued from the state of Florida, the Health Department, and the CDC. Under all these criteria, however, the guidelines for individuals continues to require good hygiene and hand washing, regular disinfecting of surfaces, encouraging the use of face covers while in public, and continued social distancing. Those that feel sick should stay at home, and everyone should avoid unnecessary trips and travel to help minimize exposure. I want to thank everybody in the community for adhering to these guidelines and for continuing to follow social distancing protocols and practices. Please continue to check on your friends, family, and neighbors. Take advantage of virtual visits through video calling and online messaging. What you are doing is working, and without your help and commitment to our community's health, we would not be as successful as we have been. But we cannot lose our focus, and we cannot give up on what is working. Let's keep stopping the spread. We all have a role to play in the fight against this virus, and we can all continue to make a difference. Thank you for your time, and we'll see you again next week.